Ryan. I'm Paulette Garin.
Oh, hey Paulette, how are you doing?
I'm doing well. And right now I am the Wisconsin State Coordinator for the Leadership Conference on Guaranteed Health Care. And I'm here on behalf of the Leadership Conference for Guaranteed Health Care. And I'm here to ask you formally to support John Conyers' House Resolution 676, the United States National Health Care Act. Now I know you already gave...
What's the number again?
House Resolution 676.
This is the single payer plan, right?
I know you've already said that you do not support single payer, but I was reading your issues paper that you just put out, your updated document, and my concern is where do you eliminate or attempt to eliminate the disproportionate influence that the insurance companies currently have on our healthcare system? I mean, creating risk pools that you propose puts the chronically ill off to one side. We don't reduce costs. All we're doing is shuffling them around, and it appears that the burden will still be upon the taxpayers. I'm not finished, please. Okay. And you're.
Opinions. Keep going, Paul.
All right. All right. And the plan does not appear to be cost efficient. It's cost inefficient and fails to address the fact that 31 cents of every dollar spent on health care in this country is for administration and not for patient care. The $2,500 tax credit is only a down payment. I currently will spend this year $10,000 approximately on health care. I will spend more on health care than I will spend on housing. I mean, it's not really going to help me. Health care reform is the only real economic stimulus plan that we have. I mean, the number one factor affecting any company's bottom line, be it a large corporation or a sole proprietorship, is the exorbitant health care costs. Right now, 14,000 Americans are losing their employer-provided health care each and every day. That's not counting the uninsured, the underinsured. This is new people. And in our congressional district, look at the unemployment rate we have in the city of Racine alone. And look what's happening in Janesville to the GM workers, not to mention everyone else who's lost a job in the first CD. Single-payer health care, Mr. Representative,
I'm not
right?
trying to I just want to give other people a chance. So
I understand.
I just want to make sure.
I understand. Senator Feingold afforded me the opportunity to make my complete statement. Okay. Single-payer health care
Hey, that's pretty funny.
is publicly funded, but it will be privately driven by patients and doctors, just as you want to have happen. You personally benefit right now from a government-provided health care plan. And isn't it fair to expect that every American citizen should be entitled to the same level of care?
They're all private plans I picked from. They're private plans my employer, you, provide. It's not a government-run plan.
Okay. But health care reform is the only real stimulus plan we have, not bailing out CEOs and failed companies. And health care reform is the civil rights movement of our time. Will you please step up and support House Resolution 676?
Okay.
Thank you.
You bet. Nice to hear from you again, Paul. No, I agree healthcare reform is a huge issue, big crisis. You and I just disagree on how to solve this problem. Do we agree that this is a major problem in this country? Do we agree that we ought to come up with a system where everybody has health insurance, has health coverage? Yeah. We just disagree on the best way to achieve that. That's all. It's an honest disagreement. So let me leave it at that because you and I can spend the next half hour. But I think didn't we talk about this bill before? I've been asked at town halls about this bill before, so.
I have not personally asked you. I've sent you emails.
Other folks have asked me about this Conyers bill. I just think there's a better way to do it. That's all. And we just disagree on the method. But I got all these hands, so let me just go ahead, you and then ma'am.